Caroline, I didn't know that you knew where I went to school. And Caroline, I don't know the color of your dress and where I come from. I say no more. Thank you so much. I'm standing here on behalf of His Excellency the Governor of Nairobi City County as his Minister for Health. So whatever I'm going to do or read is his speech. But as Caroline has just said, having international masters in public health, I would be able to niseme, or those who don't know Kiswahili, niseme kiasi kidogo, or I say something small after his speech. It is not easy to get to the shoes of His Excellency the Governor, but since he has given me the powers to do health matters in the county, I will try the best I can. Our Excellency Toyin Saraki, founder, President Wellbeing Foundation Nigeria, my dear brother whom I worked with in the ministry before joining he actually gave me permission to go back to go to the county, Dr. Nicholas Moraguri, Principal Secretary, Ministry of Health, Kenya, Mr. Omar Isa, Chair, AMREF, Health Africa International Board. Yes, a lot of sons of humor since I sat there have been enjoying Kiswahili sanifu kutoka Tanzania. Dr. Kithinji Kitai, Group Chief Executive Officer, AMREF Africa, invited guests, ladies and gentlemen. It is a great honor for me to be present here with you as we close the Africa Health and Gender International Conference 2017. Nairobi is very proud to have been chosen to host this very significant conference, which sought to share knowledge, partnering to the health issues in Africa. As a continent, we need to engage candidly about our health challenges in order for us to find lasting solutions. From these discussions, we can then craft a plan to achieve sustainable development goals on health, a plan that is specific for Africa. I take this chance to thank major partners of this conference for their commitment to improving health for our citizens. Ladies and gentlemen, Nairobi is the country's capital and it's the main economic hub. This in turn makes it home to large populations of people, many of who live in informal settlement, and I would say 65% of Nairobi inhabitants stay in informal settlement like Kibera, which I know many of you have heard about. The challenges that contribute to burdens of disease in Africa, and particularly urban informal settlements and in rural areas, would include HIV, AIDS, tuberculosis, and other communicable diseases like malaria, the rising incidence of non-communicable diseases, maternal child morbidity, mortality, and injury-related problems, especially because of road accidents. In the informal urban settlements in Kibera, like Kibera, health facilities are few and are often unable to cope with the number of patients they receive. Communicable diseases spread easily, and health complications brought about by poor hygiene and sanitation, as well as the congested nature of experienced in this area. Maternal health care becomes very difficult to access in these areas too. The focus of AMREF Health Africa on maternal health by training community health workers in this and other marginalized areas is therefore commendable. And on that, I would also say that we have identified in Nairobi County health community volunteers, and we are putting them in the payroll as soon as possible. Ladies and gentlemen, financing of healthcare is a major issue within our city and the country at large. Most Kenyans use public health facilities, and devolution of health to the counties was designed to ensure that each county is able to bring health services closer to its people. While the process of change has not been easy, the county governments have the goodwill to ensure that we provide the best health care for our people. And in this vein, public-private partnership is a frontier we need to build on for those services provision. Such partnership will enable us to reach out strategic health goals within the shortest possible time. Sir, Dr. Nicholas Muraguri, I would like to say in Nairobi County, we set face as far as health is concerned. And I can assure you, when we got the industrial action, the first thing I did was to write to CEOs of major hospitals which are faith-based and others to assist us in that endeavor. So at least in Nairobi County, we are ahead in exploiting that emerging new potentiality of sharing in healthcare. So I think in Nairobi, we already started embracing that, and I think we are far ahead with that, and I take opportunity to also to say and appreciate faith-based and others who have assisted us in this particular time. To achieve our health goals, governments must increase budgetary allocations at national and regional levels. I am convinced that by building partnerships, we will forge forward in delivering sustainable health care to our people. And so, ladies and gentlemen, it is my hope that the next time we meet, we will highlight major achievements. I thank the organizers of this conference and AMREF, Africa in particular, for hosting this very important forum to create avenues for dealing with specific health challenges. Thank you so much. Allow me just a few minutes or two also to take this opportunity and pose a very strong oral question. Quite a number of us in this room, we are medical providers or healthcare providers. And we have talked time and again. And it is known, even not by healthcare providers. It is even known by almost everybody. Prevention is better than cure. We have gone ahead, some of us, even to go to health promotion. And I think one of the crucial things, one of the lessons learned in this particular era, particularly in Kenya, when my brother is seated here, we all know what we are undergoing as far as doctors are concerned. Is it not the right time? Is it not the right time? This is a difficult question because I sit in policy formulation, political direction of health in Nairobi County. Is it not the right time we invest in promotive care seriously, we walk the talk? Is it not the right time we prevent diseases than treating the diseases, which are very expensive? I think it's a challenge to all of us, some of us who are at that level. Not only even that level. We have seen in Nairobi the reason why we should put community health volunteers into payroll. They seriously prevent diseases at that level. They also health promote. And studies have done that it's cost-effective to take those measures. I think we in Africa, Dr. Dhaka, if you remember the other day when we met somewhere, I think it is the high time that we walk the talk of investment in preventive promotive care. Wellness centers, Her Excellency, I want to assure you in Nairobi County, we have already established 2 wellness centers in public health facilities through my initiative, where we do blood pressure, we do BMI, we try to detect disease the earliest possible, nutrition, health promotion activities. We want to stem the non-communicable diseases in Nairobi County. And perhaps also